Yeah. So that's it. So once you are ready, you can start. This is the
Yes, let's
card.
start, sir.
Yeah, this is the card. Then insulin injections. Yeah. You have anything to ask me? You can ask. Otherwise, you can start straight away.
Uh, yes, sir. Good morning, Mister. I'm Christopher, one of the registered nurse working in this medical clinic. And for the documentation purpose, can you please confirm your name and age, please?
Yeah, my name is Ben Johnson, and
Ben
you can call
Johnson.
me Mr. Johnson. I am 60
Okay.
years old, and
Okay.
yeah.
Uh, can you please confirm the reason for the appointment, please?
The doctor has asked me to meet you, nurse. I don't know why, not sure,
Mm-hmm.
but I had some medical blood tests the other day, and he saw them and he told me to meet you so that you will discuss all the things with me clear.
Yes. Yes. By seeing your name and demographic details, I have seen your medical records, and it's showing that you have diabetes recently, and doctor advised for insulin injections. So this is the reason for your appointment. So you need you need to start with the insulin injections because oral medication didn't work well for you. So is this okay to start with the insulin injections?
I don't know whether it is okay or not, but what is the reason? Can you tell me? Why do you
Mm,
think I should take insulin injection? I have been managing my diabetes well with the
mm,
diabetes diet, medication regimen, and the suggested
mm.
exercise program. Everything is going on fine. And why suddenly I have
Yes.
to change this one? What's the reason behind that?
Yes, I agree to your points which you have made. Uh, you have tried your level best by controlling your diet and taking regular oral medications. But the point is, even the oral medications and the diet and the dietary modifications which you have done with your utmost effort, that didn't work well for you. So that's the reason doctor advised for insulin injections. As if the glucose levels are very high in your body, that could cause organ level damages such as infections, inflammations, and diabetic complications. So that's the reason doctor advised for an insulin injection. Yeah, so could you able to understand? Could you
Could you
understand this?
able to? Could you
Could you
understand? Can you
could you
understand,
understand?
or do you understand? Yeah,
Yes.
fine. That's okay. Um, yeah, nurse, I agree with that one, but I am very much scared. I don't know. How
Hmm.
can I take? Because I'm not a nurse, and I'm scared of insulin. So I'm scared of injections. First of all, I don't think I can
Hmm.
manage doing that.
Hmm. Don't worry about that. I'm here to help you regarding that. Before that, uh, regarding the insulin injections, I'll explain you in detail a little further. As these needles are very fine needles, these needles will not cause any harm or pain to your skin. So don't worry about the needles or injections. Okay.
Okay, nurse.
Um, and I need to give detailed instructions regarding the injections. So if you are willing for the insulin injections, I will give a clear explanation in detail. Can we go further?
Yeah, of course, nurse.
That's good. Uh, Insulin injections have a faster absorption rate into bloodstream, and they as normal oral medications, these are not broken down in stomach, so these are more efficient, which are sent to the bloodstream directly. It will act fast, and its efficiency is far more better than the tablets.
Okay. So,
So
right.
insulin
And
injections are
what are the
best.
locations where I have to take these injections?
That's an interesting point, Johnson. And there are few specific locations, such as below the deltoid region, means the upper arm, around the belly button, and the shoulder, and thighs, inner part of the thighs. These are the parts where you can give your insulin injections. Regarding that, I'll give you an annotation image which will give you a clear idea how to take an insulin injections. And before that, do you have any idea how to use insulin injections?
No, nurse, I don't know anything. But if you
Mm,
can explain everything, maybe I'll try.
yes, sure. I'll give an in detail explanation now. So listen carefully. These are fine needles which will be these injections will be administered into your subcutaneous tissue, which should be given at an angle of 45 to 90-degree angle, and you should leave it in place for 5 to 10 seconds, and you can administer. And you should rotate the injection site frequently to prevent the risk of lump formation. And if you are rotating, you can reduce the risk of uh, less insulin absorption.
Hmm.
So, are we on the same track, Abhinav?
Yeah, of course,
Johnson?
nurse. Of
Mm.
course, I can understand what you're telling. And what type of needle should I use? And whether can I use the same needles time and again, or I should alter? What about the regular needles or disposable needles? What exactly do you suggest regarding these things?
So, you want to know in detail about the needles, right?
Yeah, of course, nurse.
Uh, Insulin needles are just those are fine needles. You can ask as insulin injections, and these injections, these needles should be used only for 2 to 3 uses only, and after that you need to dispose in a puncture-proof containers. And once if you're opening the vial, it should be refrigerated soon.
Okay.
So your point of insulin needles, you're clear about that insulin needle, right?
Yeah, of course, nurse.
That's good. And make sure that your insulin vial is not stored under sunlight or high temperature, which would cause damage to that vial, and you can't use that after that. It should be an optimal temperature of around 15 to 20 degrees Celsius, and it can be stored in a cool place, such as a refrigerator or ice packs, etc. And before administration, you should check for expiry dates and the date of opening for sure.
Okay.
So hereafter, you are willing to do the insulin administration, right?
Yeah, nurse. Okay, I
Mm,
understood everything what you have
mm,
told, but I want
mm.
to know one more question. I want to ask you one more question. I need some more
Okay.
information.
Okay,
So,
sure. You can ask
what
me.
are there any after effects or ongoing problems or any side effects or whatever? Some bruising or some problem like that one.
There are some side effects. If you are maintaining the proper hand hygiene, and also you should make sure that you're rotating your injection site, as I said before. If you're rotating your injection site, you can prevent the formation of clumps, which is the most common problem after administrating the insulin injections. So, apart from this, there are no side effects, and make sure you're checking your blood sugar levels frequently. If you're feeling any signs and symptoms of a hypoglycemic episode, make sure you're going to the hospital or taking some sugary substances.
Yeah, that's fine, nurse.
Mm,
Thank you very much. Now I want
mm.
you to watch me giving myself an injection, and if there is any support needed, and I'll definitely ask
Yes,
you, and you can
yes,
tell
sure.
me. Or if I'm doing anything wrong, you can hint me slowly. I'll give you time to hint me. Thank you very
Yes,
much,
sure.
Nars.
Let's start with the administration and
Yeah,
do it now. Thank you.
yes. Thank you very much. That's good. You have done three speaking sessions.